Next, we're going to be looking at Rh factor and pregnancy. So we'll be talking more about what's called erythroblastosis fetalis, or hemolytic disease of the newborn. This only develops when an Rh positive father and Rh negative mother result in an Rh positive fetus. In the Rh negative mother with the Rh positive baby, during birth there will be blood mixing, and that would actually sensitize the mother's bloodstream against Rh positive. Again, this is because she's Rh negative. Her body has never seen Rh positive blood. So when it does get exposed to the antigen for the first time during birth because of blood mixing, her body will make antibodies against the positive blood. So there are no preformed antibodies when it comes to Rh positive or Rh negative, but they can form after the fact. Now, these Rh positive antibodies can attack her second baby. So if months later, once she's been sensitized, she gets pregnant again and her baby is Rh positive, again, she's still Rh negative, those Rh positive antibodies will go through the placenta and attack the baby. And that can cause Rh disease or hemolytic disease of the newborn and start to clump and cause reactions similar to transfusion reactions in the baby's circulatory system. So how can we prevent this? Well, we can prevent this by using RhoGAM, an immunoglobulin against Rh that is given at about 28 weeks during the woman's first pregnancy and a little bit before birth. This prevents the sensitization step and the formation of the Rh antibodies. And this would have to be done for every pregnancy where the woman who is Rh negative has a baby that is Rh positive. So let's review. We know when it comes to ABO blood types, we want to match that. We also want to match Rh because those are really common antigens on everybody. If someone were to get a really large blood transfusion, we'd want to match even more than just ABO and Rh factor. There's more than just those antigens, but these are the ones we consider the most. Someone who is type AB is considered a universal recipient because they don't have A or B antibodies to attack donor blood. Someone who is type O is the universal donor, and blood banks especially go after those who are O negative because those individuals can donate absolutely to anyone, even someone who is positive. It is more common to be positive when it comes to Rh factor than it is to be negative. 85% of the population are Rh positive. And keep in mind what the blood groups look like and which antibodies are found in the plasma. That's really what it comes down to when you're considering blood type compatibility. Can you memorize charts and graphs and pictures like this? Yes. But it's best just to remember what antigen is on the surface of the blood cell and what antibody, therefore, is in the plasma in order to think about preventing a transfusion reaction. And preventing a transfusion reaction all comes down to having antigens not interact with antibodies. If you need to review which antigens are on which cell, again, antigens are found on the surface of red blood cells, this is a great study slide. So for example, A positive has A and Rh antigens, whereas A only has A antigens. Keep in mind that Rh is an extra antigen, and being negative for it means you don't have it. There is not a negative Rh antigen. Next, we're going to be talking about blood typing, which is an activity that we'll do soon in lab. Now, there is a synthetic blood option, and if you want to use this, please let me know in lab in person. But let's talk more about blood typing using our actual blood. Now, blood typing for blood transfusions is in order to match a donor and recipient's blood for a transfusion. We're concerned with the donor's antigens and the recipient's antibodies interacting. We don't want the recipient's antibodies to attack foreign antigens they don't recognize because we didn't match the blood. So we can test it, and you're going to test your own blood. We're going to use something called an Eldon card that has these 4 circles. In the circles are dried antibodies, like dried anti-A, anti-B, and anti-D. Anti-D is for Rh. And there's a control circle. Nothing should happen in your control circle as far as clumping or a reaction, because that means your card is good. So how are we going to start blood typing with our own blood? Well, you can get your card and fill in data. You don't have to because we are throwing these cards away. We're not taking biohazard out of the lab. But one of the first steps to testing your own blood is to also get a micro dropper or a dropper bottle and put a drop of water in each circle. And then you also want to get a cleansing swab or an alcohol wipe and disinfect your finger before you prick it with a lancet. We do have automatic lancets. There are manual available if you want, but you want to puncture your skin by pressing the lancet firmly against the side of the fingertip. If you're dehydrated, you may not get that much blood. And then you're going to take something called an Eldon stick, which is just kind of a weird little stick with a flat end, and you're going to put a drop of blood separately on 4 different Eldon sticks. And then place those Eldon sticks separately on top of the drops of water in the circles. So what have you done thus far? Well, you've put a drop of water in each of the 4 circles. Now you've put a drop of blood in each of the 4 circles. And in each of the 4 circles, you have water and blood and an Eldon stick. Make sure you do not cross-contaminate. You want to use a separate Eldon stick for every circle. And you want to start by mixing the dried antibody with the water and the blood. Start by pressing down relatively gently, but with some pressure. And start going in circular motions from the inside of the circle all the way to the outside border so that you mix everything together really well. If you don't mix the antibodies together, you won't see a reaction, even if there should have been one. We're not going to do this step. You can pick up the card and kind of slightly tilt it left and right, but we're not doing 180 or 90-degree turns because the blood will go everywhere. And then you'll finally have your results. So if your blood type is O negative, unfortunately, you're not really going to see any results because you will have had no reaction against the anti-A or the anti-B antibodies. But the reaction we're looking for is clumping. Clumping is agglutination, and the clumping of particles is occurring because there's a reaction between the antigens and the antibodies. So if someone is type AB, they're going to have clumping in the A and B circles. If they're just type A, just the A circle, type B, just the B circle, they're type O, no clumping in the O or in the, A or B circle because you're O. So when it comes to blood typing, we're looking for that agglutination reaction, and we also would have a D antigen circle. And if there's clumping there, you're positive. We're also not going to use foil. We're just going to throw the biohazard away, so don't worry about this step. But let's make sure that we can practice this before we actually do the activity, so we know how to read an Eldon card. So the question we're answering is, what is the blood type of the individuals whose completed Eldon card is depicted below? Include both ABO and Rh factor information. All right, so this individual has no clumping in A, clumping in B, clumping in D, and the card's good. Nothing's going on with the control. So they do have B and they do have D. D is Rh again. So that would make this person B positive. So now knowing that, when you have clumping, they have B, and they have clumping, they have D, so they're B positive. What about this individual? They have clumping in A, but none in B or D, and at least the card's good. There's nothing going on in the control. So the clumping is only in A, no Rh, so they're A negative. And last but not least, what about this example? They do have clumping in A, none in B, and they have clumping in D. And we know the card's good because nothing's going weird in the control circle. So they do have A and they do have D, so they're A positive. So again, make sure you go back and kind of practice reading those Eldon cards because it's really important to know how to read those Eldon cards to do the blood typing activity in class. But that's it for this video, so make sure you watch all parts.